If there's a sheet there for them to sign, if you want to speak, the ordinance says that you can speak to anything on our agenda. The only thing on our agenda tonight is about masks. So if you'll sign your name, I will take that and I will recognize the people who have signed that sheet. If anybody comes in before we get back, would you tell them the same thing? And then when we come back in, we will go back into session and then allow each of you to speak to us before we have our vote. Thank you very much for coming. Mr. Templeton, have you rejoined us?
I am here, sir. Yes, sir.
Okay. All right, we have everybody back in session. We need to have a motion that we adjourn the executive session and then turn to our agenda. Do I have a motion?
So moved, Mr. Chairman.
Motion from Mr. Moats, second from Ms. Spencer, all in favor? And we are now at executive session, and some of you have joined us since we first went in, so we appreciate you being here. And we're going to follow our agenda at this time, and we're going to deal with public comment. Before I get into public comments, we have invited people because of COVID to either send in their comments, and we would make them part of the minutes. And since it is
71.
71, I do not intend to read the 71. I will make them a part of the minutes, but I will allow the county attorney to tell you of the 71, how many were supporting a mask ordinance and how many were opposed to a mask ordinance. So if you would share that at this time, the numbers.
Thank you, Mr. Chairman. There were 71 total. Of that, 9 were in favor of an ordinance requiring face coverings. 61 were against an ordinance requiring face coverings, and then there was 1 from a Lawrence County citizen.
Okay. Thank you. So you've heard the numbers, and if anyone would like to read any of those comments afterward, news media, whoever, you're welcome to look at those comments after the meeting, and if you want a copy of them, we'll make them available to you after the meeting. Let me say again, thank you for coming. I'm going to go through the public comment session now, and I'm going to call on Mr. Jim Pfeiffer to come and speak to us at this time. Welcome.
Thank you. I'm going to take my mask down so y'all can hear me because they're uncomfortable. But thank you, Chairman Brown. Thank you, County Council, for calling this special meeting. I'm going to steal a phrase from a famous movie that y'all probably remember, Apollo 13. And in that movie they said, Houston, we have a problem. Folks, we have a problem in this state. Now, I'm going to give you some numbers and let you dwell on that for a while. So, we continue to have an activated command center. We've had one in place since March 12th to meet the challenges of this global, state, and community COVID-19 pandemic. We collaborate daily with the South Carolina Hospital Association, the American Hospital Association, South Carolina DHEC, and county emergency preparedness to stay informed of the latest information to assure we make timely, informed decisions. This morning, we had a call with the upstate hospitals, and those included Prisma Health, Spartanburg, ANMED, Self, St. Francis. We are all in a crisis mode, every one of us. We are full in our ICUs, we don't have staff, and we are in jeopardy that our hospitals will not be able to meet the needs of our community. Let me repeat that. We are in jeopardy of our hospitals not being able to meet the needs of our community. Okay? We have a talented team. Unfortunately, that talented team is challenged by COVID. Dr. Carroll, Daphne Carroll is here from our employee health in the Montgomery Center, and she's going to speak about the number of employees that have either tested positive for COVID or are out for COVID, and that number is in excess of 500 employees. And currently we have, I think, about 50 out for COVID suspect. Every hospital experiences fluctuating census every day. Every day we have fluctuating census. And we have, even though we are licensed for 358 beds, we are not staffed for 358 beds. That's impossible. We are probably staffed to accommodate 260 to 70 beds. But currently today, we're about 230 patients in the house, of which 60 are COVID positive, 10 are PUI, under suspicion, and will ultimately end up being COVID positive. And we have, our ICUs are full, our critical care beds are full. We have 4 waiting ICU placement in the emergency room. We are running out of room, folks. We are running out of room rapidly. In preparation for surge of patients, we have identified space, equipment, supplies, and staffing plans to meet the needs. Staffing plans, but no staff. Okay, we don't have the staff to be able to meet those, to open another intensive care unit. We'd love to open another 14-bed intensive care unit, but we don't have the staff to do that. We've called the South Carolina Hospital Association and asked for their Qualibus, which is their staffing model. And the first quote is, well, the cost per staff is $100 an hour, if you can even get it. And mind you, we are battling with Texas, Florida, Arizona, and California, as well as all the other states in the Southeast that are battling for the same staff, as well as other hospitals in the state. We have bed capacity in the hospital and can convert additional beds to meet the medical, telemetry, and critical care needs of our patients if we had the staff to do that. We have the ventilators. That's a good thing. But we only have a limited number of those ventilators as well. We have enough PPE. We have enough supplies to meet the increased patient demand. Every decision is made to ensure safety and the care of patients, team members, and our community. As I said, today in the hospital, we have 60 COVID positives and 10 pending results. Today, South Carolina DHEC reported, today's numbers for South Carolina DHEC reported an increase of cases of 2,205 with a positive rate of 21.5%. And you can look at the numbers per million people. We are second. I think it's behind Florida, maybe California, but we are second behind those other states in terms of positive patients. Greenwood County has 844 confirmed cases with a 1,192% per 100,000 lives positive rate. Total South Carolina cases today, 60,220. Our number of COVID patients in the last 3 weeks have gone from 6 to 60. 6 to 60. We are begging for your help. And we've had 10 COVID-related deaths at South Regional Healthcare. Dr. Logan is going to speak about the need for masks, but I'll just say this. We have a novel virus. There is no known cure. There is treatments, but they are not a cure. There is no known vaccine. The only 3 things that you can do to prevent the spread of infection is wearing a mask, social distancing, and washing your hands. Most importantly, wearing a mask. Okay, because it is spread through respiratory. My talking today could possibly spread virus in this room. I don't think I'm positive, but there are a lot of asymptomatic carriers out there that are spreading virus left and right. Left and right. Okay? So we are imploring the county to do what the city did with an ordinance, because the confusion that'll be in our county between city and county. You go to Lowe's, you got to wear a mask. You go to Walmart across the street, you don't wear a mask. You know, social responsibility is one thing, but it's been proven in this state that people are not being socially responsible. So I implore you all to consider a mask ordinance. A resolution will not do it. Okay, that's what social responsibility is all about. So I ask you to consider a mask ordinance. Thank you.
Thank you. Dr. Logan?
Thank you, Jim. I just want to follow up just a few more things on what Mr. Pfeiffer just spoke on. Just before I came over here this afternoon, I stopped by our intensive care unit and I talked with our intensivist, Dr. Tejada, to get an update on our patients that are currently in our intensive care unit. I just want to share just a couple things and his perceptions, and he would like for me to pass on that of the things that can be done. Putting a mask on people in our community helps prevent the spread of this disease from one another. Will help prevent people from getting in our intensive care unit and going down the wrong path. Currently in our ICU, our 30-bed intensive care unit, 12 of those patients in our ICU are COVID positive. Of those, 7 are on the ventilator actively right now. The age range of our intensive care unit patients range from 43 years old in the intensive care unit to 87 years old. We have an entire floor of our hospital dedicated to caring for COVID patients. Floor 6. Age ranges on that floor from 36 years old to 92. It's not just the old people with bad chronic illnesses that are having major issues with this. Again, we currently have a 43-year-old in our intensive care unit. Our average age is probably around 60 to 65 years old of folks requiring hospitalization. I think that's real important to know, because you hear a lot that only the older people are affected or those with chronic illnesses are affected. Certainly in our community, we're seeing younger people also affected, and it can cause major illness requiring intensive care unit. Like Jim mentioned, we have had 10 deaths at Self Regional Healthcare from COVID. We have had 1,049 positive tests through our COVID line as of this morning. So that's about 1 in 100 people who tested positive through our COVID line at Self Regional went on to die. So 1 in 100 of our citizens who test positive based on those statistics could be at risk of dying, not just ending up in a hospital. What can we do to slow this down? Like Jim mentioned, there is no pill. There's no Tamiflu for coronavirus. There's nothing that can be taken like that. The best thing that we can do are to, again, practice social distancing, wear a mask when we're out in public places around other people, and wash our hands. Respiratory droplets. Why is a mask so important? Respiratory droplets. Anytime we talk, sneeze, cough, laugh, sing, out of our mouth comes some respiratory droplets, really tiny. The mask that I wear will help keep those from passing on. You hear things about, well, only the N95s work at stopping the virus, or the cloth that you put over your face really doesn't help. Well, to a degree, if you're talking about the actual virus itself, that little tiny virus that's like 5 microns in size, yeah, it'll pass right through the mask I have on. It'll pass through an N95, frankly. However, when you talk about respiratory droplets, which the virus lives on, the masks do help stop that. The cloth masks do help slow down the spread of those respiratory droplets to be spread out into that around you. So it's not just the size of the virus, but it's those respiratory droplets, which are also important. I think it gets missed a lot when we're talking about the mask, and maybe the masks aren't effective. Certainly the higher filtration rate of a higher mask like the N95s we use in the hospital, they do filter the bulk of all the virus out. I don't think that's necessary in the community setting. Certainly if we're in an intensive care unit taking care of a COVID positive patient and who's getting an aerosolized treatment, absolutely, they need that type of a protection. But in a public setting, it's not necessary to have that. There was a study published in the journal Lancet on June the 1st of this year. It was a big study reviewing 172 studies. So it was a meta-analysis where this one review article basically looked at 172 studies on how can this coronavirus spread be slowed. And the conclusion was that, just like we just said, mask wearing, hand washing, social distancing, in the hospital setting wearing goggles to help prevent potential eye contamination. It's not thought that out in the community that the concentration of virus is so large that you need to wear eye protection out in the community setting. However, in the hospital, certainly we would. But again, as a summary in one of the summary statements of that article, again, summarizing 172 other studies looking at preventing the spread of coronavirus, says face masks very well could result in a very large reduction in risk of infection. So if at our hospital, in our community, that we have 1,049 confirmed cases, and we've had 10 deaths, or 1 in 100 cases in our own little micropopulation here at Self Regional have died from this, and we know what we need to do to prevent the spread or slow the spread down, I think it behooves us to follow through on that and to put something in place. I know maybe the message doesn't get out to the community of what I'm speaking to you guys today, but I'd certainly be glad to speak or answer any questions whenever the time comes if you'd like to answer any questions. Thank you.
Let me just stop there and say, does anybody have any questions?
I did, Chairman. We spoke earlier today, Doctor, about the fact that at a state level, these sanctions haven't been placed. And I will tell you that I'm one person who believes that we lifted restrictions far too early. I think that's a great part of why we've seen this escalation. But when Mr. Pfeiffer spoke just a minute ago about the Hospital Association, why has the Hospital Association not demanded of DHEC or of the Governor's Office the same thing we're talking about tonight, so that we wouldn't have to be doing this in an incremental circumstance as we are?
Go ahead, Jim.
Mr. Lane, we actually, South Carolina Hospital Association has religiously tried to get DHEC and the governor to pass a statewide ordinance like they did in Texas. That would be the simplest thing for us to do. And in fact, we talked this morning with the hospitals in the upstate that we are going to do a press conference of all the hospitals in the upstate and say, wear a mask, damn it. Because I can't explain the governor's rationale. All we can do is implore him because we are in a crisis mode. We are at the point where there are going to be hospitals that will not be able to take incoming patients. Self is close to that. And the only way we can control this is by getting people to wear a mask. It's proven you wear a mask, in 6 weeks, infections drop by 85%. 85%. We can't flatten the curve if people won't comply. So we are imploring the governor every day. In fact, our senator, Lindsey Graham, was at the SCHA today and had several hospitals meeting with him to try to do the same. Believe me, if the governor were here today, I would tell him the same thing. And people have asked him, and he seems to be adamantly opposed to mask ordinance. I don't know why. And it's wrong.
Any other questions? Thank you. Justin Free?
Well, I want to speak on the other side of the coin of what's being voted on tonight. A lot of doctors in here, lawyers and educated people. I'm a veteran. 19 years of service, did a stint in Iraq for a year. And the part of all of this that weighs on my mind is passing these ordinances at the end of the day is a loss of freedoms. It's a loss of rights. My experience tells me that I've got 3 very close personal friends of mine that committed suicide because of combat PTSD. I've got probably 2 to 3 people that reach out once a month that have to be talked out of it. I have a wide variety of friends that have served with me over my 19 years. Nobody served saying, man, if we can just lock this country down a little bit better, we'll be okay. Everybody serves in the name of rights, liberty, and freedom. So the thing about the mask, personally, I have no problem with anybody that wears a mask. I don't think that there is a case to be made too much for you should or you shouldn't. I think it falls on personal responsibility. It falls on personal choice. I am by no means in favor of abortion, but they have one of the best slogans in the world, my body, my choice. It don't get much freer than that. And I think that's how it should be left. But the vote tonight is going to set a standard. And the problem that a lot of people that feel the way I feel have with the standard that's going to be set tonight is, where do you draw the line? If we put a mask ordinance in place and the numbers don't drop, then when do we make it standard for vaccines? When do we make it standard for weekly checkups? When do we make it standard for mandatory COVID-19 tests? When do we make it standard for where does it stop? And if we can't sit down and have a better conversation and come up with a better plan of where it can stop before we start it, then I think that what we all should do is revert back to the standard, which is freedom, liberty, and rights. It's the right to choose. And I started a Facebook group 2 days ago to call out attraction. We have already organized and put together a protest that will be taking place right out here at the fountain on Saturday. Looks like we're going to have a big turnout. And I think that with all the things that are in play, we just have to consider more than one side of this coin. We have to consider what we're going to give up to do this. I feel like that I'm a pretty successful adult. I own my house. I have 2 beautiful kids. I've got a daughter that graduated high school with an associate's degree. I have a beautiful wife that is college educated and teaches college. I feel like we have made good choices in our life, and I feel like that I'm not in a position for people to make choices for me, especially on this. So that's all I wanted to say. Thank you.
Thank you.
Mr. Freed, before you sit down, can I ask you a question?
Yes.
First, thank you for your service.
Thank you.
I believe I've had tons of calls, emails, text messages since last week in regard to this. Compelling arguments on both sides, and you just heard from the medical professionals speaking here today who firmly believe that the masking will have positive impact. As someone who is concerned about personal liberties, are you wearing a mask as you go about in your day-to-day life?
No.
You aren't?
Now, I've put on a mask one time. It was to take my son into the doctor's office.
Okay, well, you see I am today.
Right.
Now, I can't tell you that I'm wearing a mask 100% of the time, because I don't. I really do it circumstantially.
Right.
You know, if I feel like I'm at risk or my son's at risk, depending on where we are and what we're doing. But for people who are concerned from a personal liberty standpoint, do you believe that, because my recommendation on this was the strongest possible worded resolution to everyone in Greenwood County, that we would not just suggest, request, but in fact beg that they follow every health care precaution in helping fight this virus. Do you believe that people who are concerned from a personal liberty standpoint would be more inclined to wear a mask short of an ordinance that orders them to?
I absolutely believe it. I could show a lot of post comments that have gone back and forth on the Facebook page where a lot of people will actually be showing up to the protests in a mask and possibly even gloves. The problem is not wearing the mask or not wearing the mask. The problem is mandating it. That is the issue that they have. I'm not educated enough to tell you if masks really work. I know I've seen more masks on more faces in the last 30 days than I've ever seen in my life, but the numbers are still going up. I know that people that wear the mask swear up and down that it's what's keeping them safe. But at the end of the day, when there's so much evidence on one side and the other, and both sides can be disputed, I feel like that is why we leave it to choice. And choice and freedom comes with a lot of personal responsibility, and personal responsibility is a heavy responsibility. But at the end of the day, that's what we have in this country. That's what we have in this county. That's what is required of the individual citizen. So I know that social responsibility is also a thing, and I somewhat understand that. Personally, I have been social distancing ever since I got home from Iraq in 2006, and I don't have a problem with the idea of social distancing. And it's like I said, I don't have a problem with the mask. The problem that I have is if people cannot clearly define to me where lines can be drawn with mandates, then the standard that's being set with the mandate is a dangerous standard. It opens the door, it opens Pandora's box per se, to be able to run with it unlimitedly for any reason that anybody can come up with. And there's always going to be some kind of natural disaster if that's what this wants to be chalked up to. There's always going to be a pandemic. There's always going to be an issue that we could use to take liberties away. But at some point, you got to leave it on the person. You got to leave it on the individual.
Thank you, sir.
Thank you.
Appreciate it.
Stephen Shinrell. Some say Chanel, some say Chanel. What is it, Stephen?
It's Chanel, Chairman Brown. Thank you so much. Thank you, County Council, for allowing me to speak today. Though I'm also with Self Regional today, I come to you to talk to you as a father. Me and my wife are parents of a child with complex medical needs and disabilities. And of course, we've been abiding by a social distancing and mask for long before it was popular and hip to do in Greenwood County. Wearing a mask is more than just, it's just a mere convenience that could potentially save many lives, as we've already heard from healthcare professionals. It is our social responsibility to help protect the most vulnerable citizens in this county and city. And I think right now with Greenwood City going towards the ordinance, it's starting to take place, and hopefully we'll see that come forth. We need to do it in the county as well. Just as we stated before, the boundary lines for city and county are very confusing. We know that as a community as it is, and it's almost to the point where, as it was mentioned before, walking across the road, the bypass, and you're in a different section of town. We're not here to request a measurement to restrict anyone's freedoms. We're beseeching a mandate so that lives can be saved. The death of one Greenwood County citizen is far too many. And then personally, in conclusion, I feel that wearing a mask is an everyday thing to protect my daughter as it is, and other vulnerable citizens in our community. We've seen firsthand that with social distancing and masks and hand washing, we can make a large difference, and we need to move towards that position now. And if it's also possible, I've received an email from David Henderson, who was unable to attend today, but he said something very prolific about the mask wearing. He stated, wearing a mask for the public good is no more intrusive than obeying speed limits and wearing a seatbelt. They both save lives. And if you all recall, when we passed that seatbelt mandate many years ago, it was met head on, but now we see that it does save lives. This is where we need to move towards for the mask ordinance, and I plead to you guys to make that vote today. Thank you very much.
Thank you.
Yeah.
Any questions of Mr. Chanel? Thank you.
Thank you.
Chris Weidman?
Good evening, council. Can y'all hear me?
Again?
I just want to say that I'm for the mask. I'm 100% for the distancing, but please don't mandate it. You can revolutionize it because it's taking away our rights to breathe, and I'm claustrophobic myself. I wear CPAP at night, but I don't want to wear a mask all day during the day. Because if I wear one at night, I don't want to wear a mask all my life. And when the city, what they did last week on mandating masks in the public places, I read like on Facebook that they're going to take their business in the county or elsewhere. So like if you happen to mandate, which I don't condone, I think you're pushing businesses and people away. So I'm begging you, make it revolutionary and not mandatory. Don't become a communist city. This is Greenwood. This is not Russia. Thank you very much.
Anybody have any questions of Mr. Weidman? Thank you. Dr. Hughes?
Good evening, ladies and gentlemen. Thank y'all for having this meeting tonight. I know it wasn't supposed to be until the 21st. Mr. Brown, I asked you, please get it a little bit earlier. I thought 2 weeks was too long to wait. And for the invitation to speak. I'm Cecily Hughes, and I'm a pediatrician here at Self Regional. I've been practicing here since 1998. I've raised 3 girls here with my husband, Alan Hughes, who works for Greenwood Fabricating and Plating. As you know, and as we all know, we are in the midst of a global pandemic that is historic. This is arguably the greatest threat that Greenwood County has ever seen. I don't know of another one. It not only affects our health, y'all heard about the health, it's affecting the education of our children And it is affecting now our local economy. Our global economy has been affected, our national economy and our global economy. And I'm going to speak to those things today. We're here today to consider a mask ordinance, which is what I would recommend. And I'm in favor of that. We're experiencing high-level community spread in our state, and I wish our governor would have already issued this, and we wouldn't be here tonight. We'd be going and doing something socially distant with our families. We're going to have a hard time opening our schools in a safe way, person to person, like the American Academy of Pediatrics thinks is best for our children. That is what we all want. Mothers and fathers, grandparents in here. Many children do better in person, but it has to be safe. We get asked every day at our practice, should our kids go back to school? And that's a hard question to answer with a percent positive rate of 20+% in our area. So it's hard, I can't answer that question right now for my patients. Our local economy is being affected, and it's hard to do business right now in Greenwood County. My husband, who I spoke about, who works at Greenwood Fabricating and Plating, right now they are experiencing up to 10% reduction in their workforce due to their employees having to quarantine because of exposure or illness. Now, they have had a policy in place since March. They are not experiencing spread within the organization. They do contact tracing in the organization, and they're not experiencing spread. The employees are bringing it in from the community. And so the employees aren't wearing their mask out in the community. So that's affecting their business. There's overwhelming evidence that the mask does reduce the infection. We've heard it, and there's consensus there. We have to wear the mask, we have to social distance, and we have to wash our hands. Number one is wearing the mask. Many of our citizens aren't complying, as we're seeing. And so now we're at this level where we have to, I believe, mandate it, because our citizens aren't complying. And we know that's the answer to reduce the spread, because we are in a crisis, as Mr. Pfeiffer said. I've heard the argument, it's not enforceable, people aren't going to comply, et cetera, et cetera. But I would argue that we don't catch everybody who litters and we don't catch everybody who speeds. But we have those laws in place to protect the safety of our citizens. A mask ordinance protects the safety and it protects the health. It allows us to educate our citizens and it allows us to grow our economy. Without it, we may have to shut down again. Nobody wants that. We don't want to shut down again. We don't want to be forced to shut down again. I mean, that's a freedom that's taken away when we get forced to shut down again. And we don't want that. We have a simple thing we've been asked to do, and we've been asked over and over and over and over again. Put a mask on when you are in public. People aren't doing it. And so since this is the greatest threat we've ever had in our community, we have to do something about it. I like to say that the mask equals freedom. Freedom to go back to school, freedom to work, freedom to see our relatives, and freedom to be safe from illness. We can be free by wearing the mask. Freer. Thank you again, and I urge y'all to pass this ordinance.
Anybody have any questions about the use?
I have a quick one, Mr. Chair. Can you hear me?
Yes, this is Mr. Templeton.
I believe I heard Dr. Hughes say 20% of our community was infected. Did she mean to say 20% of those tested are infected?
20% positive rate in the state. That is a rate that has been going up and up and up. We were down like 2 and 4% in May. Now we're up to 20+% of the people getting tested are testing positive. Okay, and that's what we have to look at, is that percent positive rate. A lot of people talk about, well, it's higher numbers because of we're testing more. We are testing a lot more, and when we're testing more, we're finding more of the percentage that we're testing. Back in early, like April, May, we were seeing 2% of the patients we were testing coming through were positive, and most of those guys were symptomatic. We have a lot of people out there that are going to get tested just because for reasons that they have on personal reasons, and they're coming back positive. And they weren't really even sick. Those are those asymptomatic and pre-symptomatic people. So those rates are going up. I've watched Mr. Pfeiffer send out that email every day, maybe excluding the weekends, since March. Guys, in May, we had 0 inpatients positive with COVID. You've heard the numbers today. It's never gone down. The only day it ever went down was because somebody died. Since then, it's going up and up and up. So it's not just our health, but everybody's tired of hearing about our health. I mean, we've heard it. Now we're having to face the consequences of educating our children. They're our greatest asset. They don't get served as well on Zoom. Nobody's served as well on Zoom. It's affecting our economy. I mean, you've heard the hospital numbers where you'll hear them from Daphne. We don't have staff, enough staff because of quarantine issues. Greenwood Fabricating and Plating, not a huge company, not a Fuji. Fuji might speak to it, but 10% of workforce down. That's affecting our, and then they can prove that they're not spreading it within their organization because of these. They make their employees wear their masks. They take their temperatures. They make them socially distant. Well, they can't control what they do outside, but you guys can.
Mr. Templeton, you have any other questions?
Let's check.
Mr. Templeton? Ms. Childs?
Just cutting in and out, Mr. Chairman, but that's very much this time.
Thank you.
Dr. Hughes,
Yes, ma'am.
have you, taken care of your children at this point with the coronavirus?
We have children that have tested positive. Fortunately, they have not been terribly ill. They have had flu-like symptoms and of all the patients that we have had, they have recovered. Now you have heard on the news about the multi-symptom inflammatory disease. We've had 2 patients with it in South Carolina known so far. I will say in Chicago, where Dr. Fuquay's daughter is a pediatrician at a large children's hospital, they're admitting 1 a day with multi-symptom inflammatory disease. Dr. Fuquay told me about 3 weeks ago, give it 2 weeks, we'll start seeing them in South Carolina. She's exactly right. It's here, and we have 3 ways to affect this illness. 3 W's. Wash your hands, watch your distance, and wear your mask. The 3rd one's the most important. And if our citizens won't do it, then we have to mandate that they do it.
A lot of people that call me today have no faith in the numbers. Can anybody speak to the numbers? They are alleging that the numbers of positives are inflated, and I mean, they threw out all kinds of things today. I mean, I must have gotten 25 calls, and they're just saying that DHEC is overcounting people. There's duplicate counts. For 1 positive, they're counting them as 5. And, I mean, can anybody address that issue?
I can't, Matt, you may
I'll
can.
speak to it.
Thank y'all.
Thank you.
Specifically to DHEC, I mean, when they get a positive reported to them, they will put that in their numbers. Of the ones that I reported to you earlier, each one of those have a medical record at our hospital of a test that we sent. So our numbers are our numbers and are the positive results. What's coming out of DHEC? So that puts us at what I mentioned before, about 1 in 100 people who've tested positive through our organization, through our testing line, have died from this. So, and those are, again, self-reported numbers, not necessarily DHEC numbers, if that helps at all. But our numbers at the hospital are legit numbers. And I've seen things on Facebook, probably like you have. Someone went to the ER and they didn't test them for COVID, but they had symptoms of COVID, so they told them they had COVID. And so those numbers are not counted in our numbers. We will only count a positive if we get a test result that is a positive. When people come in with a symptom and we send them through our testing line, when they come through our ER, we recommend that they quarantine and treat themselves as if they are positive so they don't potentially spread it around while we're waiting on the test to come back. But there's perhaps a miscommunication there, but they do not count on our numbers as a positive test unless we get a test result which is positive.
Thank you. Dr. Carroll.
Whatever you guys decide today, thank you for taking the time to look at it. I appreciate it.
Dr. Carroll, you're gonna have to speak up just a little bit more.
I'm
Maybe.
sorry, and I prefer the mask, but I'm very
Okay.
small voiced. I am Daphne Carroll. I am the Director of Employee Health at South Regional Healthcare, which entails trying to keep our work staff at work, trying to protect them from infection, contact tracing. I am also a physician educator at the Family Medicine Residency Program. And I'd like to you guys have heard the numbers. I want to make a few points that I don't think have been made yet. One is the talk of masks and being the best way to prevent infection. But the masks work best if we're using them for source control. That means they work best if the person who is shedding the virus is the one wearing the mask. And according to the infection control experts at Yale, about 15 to 30% of your cases in the community are currently asymptomatic. That means they're asymptomatic carriers or they're pre-symptomatic. It's before they've developed sickness. Now that person not wearing a mask is the one that's spewing virus in the community. The cloth mask that you're wearing will give you some protection. But the cloth mask that they're wearing, the asymptomatic person, gives you the most protection. So my mask protects you and your mask protects me. It'll give me a little protection that I'm wearing a mask in the community, but if you're wearing a mask, it protects me more. Now, the surgical PPE that we wear obviously gives us a little bit more protection, but what we're wearing in the community, when we're asking people to mask, we're asking them to protect their neighbors. Now, I don't love wearing a mask. I'm wearing it already 8 to 16 hours a day. I'm on call tonight. I'll be wearing this mask most of the night. I've worn it all day. But I love my community. I love the people I work with. I love my neighbors. I love my children. I love everybody in this. I love Greenwood. And my putting on this mask when I go to Walmart is my way of saying, I know I have a high-risk job. I am protecting you from me. More than me protecting. I can socially distance to protect myself. But when I'm out in the community, I'm trying to protect you. And that's part of why we're pushing for the mask ordinance, is it so that people, I think there's a large misunderstanding. I don't think people are deliberately being malicious. I think they're just saying, I have the right to protect myself or not. Kind of like I have the right to get vaccines or not. I don't think they realize that when they choose not to wear the mask, they're actually endangering their neighbors. And I'd like to tell you a little bit of story that illustrates it. I could tell you dozens, but I think it would be a HIPAA violation, so I want to tell you one of a relative. I have a cousin, he's a young man, probably in his 30s, and has 2 children, and his wife, and they weren't socially distancing terribly well. They were in the low-risk group, and they visited his mother. Shortly after, his wife and child tested positive for COVID. 8 days later, his mother is in the ICU, on her belly, on a ventilator, fighting for her life, and he is sick. Sick, worried about her, and sick knowing that they could have protected her, but they thought the mask only protected them. And so that's part of why I'm asking. We are having staffing issues at South Regional. Dr. Pfeiffer told you a little bit about those. We had Thursday, when I looked at the specific numbers, we had 55 employees that were out because they were either symptomatic from COVID or because they had been exposed to COVID. Now here's the stunning part. We're protecting ourselves at the hospital. Only 2 of them were hospital exposures. 53 of them were exposed in this community and could have been protected if everybody was wearing masks. So now we're looking at how are we going to staff our ICU beds. We have 30 ICU beds. This morning, 29 of them were full, 13 of them with COVID patients. If we keep getting more sick patients, where are they going to go? 8 to 10 days after somebody's infected, that's the time they're critically ill and end up on the ventilator. So what we do today is going to affect what's happening in the hospital a week or 2 from now. And I'm very concerned that we won't be able to meet the needs because we'll run out of beds and we'll run out of staff. I just want to protect Greenwood. Then another point I want to make is that mask ordinances protect employees. I have a couple of friends, one of them works in a small business and was told, don't wear your mask, it will scare the customers. So they've been told you cannot protect yourself because it will expose the customer, because it will scare the customers. I think that a mask ordinance would allow and empower employees to protect themselves. Now, I would love if we could just make an appeal to the community and everybody would hear this and have enough concern for each other that they would wear the mask. I do have that kind of faith in Greenwood. What I don't have faith in is that there isn't more misinformation than information out there that is not letting people know how important this is.
Any questions of Dr. Carroll?
Thank you, Mr. Chairman. Thank you for coming tonight. I do have one question. You made a statement, and I've heard this from some of the other folks. How do you know that you say that they work in an environment where they wear a mask, but they caught the virus outside of that environment? How do you know that the virus was contracted not in their mask environment?
Yeah, absolutely.
Because I think
Great
we all know the mask is not 100%. It does not guarantee any of us, if we wear it all the time, that we're not going to ever have it.
Right.
So how do you back that up?
Yeah, that's a great question, and that's through contact tracing, which is what DHEC does, and it's what I do. It's part of my job, and the 2 nurse practitioners that work with me. So whenever there's a positive, they're asked, who have you been within 6 feet of for more than 15 minutes? Then all of their contacts are contacted, and they're told to quarantine and monitor for symptoms, or if they're in a high-need job, wear this full protective equipment and monitor for symptoms. And then those numbers, the ones that end up turning positive, that's where that's coming from. Now, obviously, there's going to be some people who come with symptoms, and we don't know where they got it. We can't trace it. But most of what we're seeing with the contact is through contact exposure, so it's going forward. You were exposed, this is the positive person, monitor for symptoms, and then they end up becoming symptomatic.
Thank you for that explanation.
Any more questions?
Because I was gonna ask the same question that Councilman Moore asked about, being in the inside and, you know, as opposed to on the outside. We are saying that we should be wearing masks and stuff in the community, but I survived COVID and I'm healed. I was in the hospital 6 days and there was staff that came in my room that did not dress up or suit up like they needed to be for me to be a COVID patient. So we know we can get it in the community and not wearing a mask and stuff. But you're 4 people or 3 people for you, everybody talk about healthcare. It's very important. I'm an RN myself. But me lying there on that sick bed, looking at people coming in my room that did dress up, and we want to look and say what the community is not doing. And some people in the hospital are not doing it, that's a problem.
Would you mind telling me when you were in the hospital?
I was in the hospital June 6th to 10th.
Yeah, that grieves
I mean,
me
I stayed 6 days.
because we have
16.
mandatory masking in the hospital, and people are also expected to wear eyewear when they're in patient. That's a new recommendation recently. So it grieves me that people weren't wearing a mask, and honestly, if we find out about it, they probably will do.
So again, back to what he said, you could have had employees in there that were around COVID patients such as I, and took it right into the community.
Any other questions?
Can I ask you a
Thank
question?
you, Dr. Carroll.
Thank you.
I'm not gonna recognize you again, Mr. Gray.
I had a question, I was just wondering if I could ask.
Now, I have allowed you to speak, but I am gonna break protocol and let your wife speak because she raised her hand.
I just had a question.
No,
What,
come to the platform, and I'm gonna try to be as open and accommodating as possible. You should have signed the sheet, but we're not gonna back your head.
well, I've never been in one of these, and you asked who had questions. I didn't know we weren't supposed to,
Go
so I
ahead and speak.
apologize. I didn't have a question about alleged CDC hoax or anything like that, but I've heard a couple individuals, I wrote names down, but to save time, speak to self-regional staffing issues and the inability to have the staff that they need. And I'm not going to pretend to know what goes on at self. Like my husband said, I'm a college professor. I don't work in the hospital system. My question was, I remember back in early to mid-April that the Index Journal and some other news sources had put out an article saying that there were huge staff reductions by self. I think it was like 850 employees. So I was just wondering how many of those employees have been able to come back, or if those 850 furloughs had anything to do with not having enough staff maybe it is, maybe it isn't. That was just my question that popped up in my head.
Ms. Viper, do you want to answer that?
So the staff, there were 653 staff that were furloughed in, I think it was March or early April. Of those, all of the clinical staff are back. There's about 140 non-clinical staff, engineering, et cetera, that are still out because of downturn in elective procedures. But all of our clinical staff are back. In fact, if there were any out there, we would multiply them and bring them back. So yes, they're all back.
Thank you. I'm going to close the public comment section of our agenda at this time. And we do appreciate all of you coming, appreciate all of you taking the time to make your comments. And to move this to the position where council can take action, we have been provided with some sample ordinances. In fact, we have 2 ordinances, and on one, the county attorney has placed a 1, and on another emergency ordinance, she's placed a 2. And then she has also given us a resolution. For the benefit of those in attendance, Madam Attorney, I'm going to ask you to take each one and tell if we adopt ordinance 1, what it will entail. If we choose to adopt ordinance 2, what's the difference, and if we adopt the resolution?
Both of the emergency ordinances that are before you have the same applicability and the same exemptions. Essentially, they would apply to the unincorporated areas of Greenwood County, all commercial businesses, retail establishments, restaurants, county-owned and operated buildings, public transportation, any enclosed public space essentially would be included in the ordinance, where any enclosed public space where people are not able to socially distance. So right now, I'm more than 6 feet from everybody in the room. So it wouldn't apply to me right now. Now, if I go and sit 3 feet from someone, it would apply. So the applicability and the exemptions are the same. The exemptions are, I think at this point, pretty standard for what most people are seeing in the ordinances statewide. People with a medical condition, children under the age of 10, people with religious objections, those kind of things. The difference is the ordinance that you have that is marked with a 1 has civil fines that are provided for enforcement. An individual who violates the ordinance is eligible for up to a $25 civil infraction, and that each day of violation is a separate offense. So if I'm caught on Monday and I'm caught again on Tuesday, I'm looking at $50, not $25. A business is looking at a $100 fine. Again, each day is a separate offense. So multiple days, your dollar figure goes up. Also, a business would be looking at, for repeated violations, which is defined as more than 3 citations, a business would be looking at possible county action from a public nuisance standpoint as prescribed by state law. So possibly injunctions and actions taken to enforce compliance on the part of that business. So that's ordinance number 1. The one you have that's labeled with a 2 is more modeled on what they did in Beaufort County, which the desired means of enforcement are education and voluntary compliance. And then there's also, if a business has repeated violations, then you can go after them for a public nuisance standpoint as prescribed by state law. Those are the 2 ordinances that are before you, and then the resolution
Before we
is.
move into the resolution, ordinance 2 does not have the $25.
Correct.
Correct. Okay, the second question I have is, does either one of these ordinances mirror what was passed in the city of Greenwood?
No, sir.
Could you tell us the differences between their ordinance and the ones that you have proposed?
Without getting into specifics, I think the applicability is broader than what was passed in the city of Greenwood. but the fines are less. And I haven't sat down and gone line by line and done a comparison, but that would be my general, just off the cuff answer. I think it applies more broadly, but the fines are less.
Okay. All right, now the resolution.
The resolution basically just strongly encourages people to wear face coverings and follow the other CDC and DHEC guidelines of hand washing, social distancing, but there are no fines and no mandatory requirements.
All right, you have heard the explanation of the county attorney. You have 3 ordinances before you. Since the chairman does not normally make motions, and I take motions from my colleagues on council, I feel that I will exercise some discretion that maybe some people may agree with, may not. But before a motion is accepted, I want to say that I have heard the medical community very loudly and very clear. I, for one council member, am in favor of passing an ordinance and probably passing number 1 ordinance, which has the $25 fines. I think we need to mirror as much what's inside the city of Greenwood as possible, and that ordinance will do it. I am concerned about your ability to treat these people as the numbers go up. I'm not a healthcare professional, never have been one, never will be, but you folks are, and I trust you. I go to doctors and I trust them to tell me what's happening as far as health. And I, for one, am going to listen to you and I will vote accordingly. This gentleman talked about his service to the nation. I too have served 4 years. 4 years are the best of my life. And we all have that, and I give it my best, and I represented my rights and everybody else's rights. But I am concerned, the people that are opposed to this ordinance is the very reason why we're here tonight. They're not wearing masks. And more people are gonna get sick, and more people will have the possibility of losing their lives. I've got family members that I care a lot. As far as rights, I have a 96-year-old mother who is at Emerald Gardens, and I have not seen her in 4 months. And you couldn't give me good money to go see her and put those people in jeopardy. I appreciate the fact that it's locked down. And I could sit here all night and talk about my rights to see my mother. And it's hard, but that's the best for her and the best for all of those other probably 100+ people down there in that facility. So rights are rights, and I understand what rights are, but this is the time that we become leaders in the community and do what is right and follow on the right side of this issue. And I support passing an ordinance and requiring people to wear a mask. Now, with that being said, and since I don't make motions, I'm going to entertain a motion from council on which ordinance you would like to propose that we adopt. What is your pleasure?
Chairman, before we do that, are we open for more discussion?
If you want to make a statement, that's your right. Yeah,
I think I would like to.
sure.
I want to make it clear that I am 100% in support of our medical community. I believe that every citizen in Greenwood County should practice every possible healthcare recommended safeguard. The concern that I have had, and the reason you all know that I've spoken to you about my belief that we should enact the strongest language of a resolution, is because I have concerns about the legality of an ordinance. County attorney has spoken directly to us and told us that she doesn't believe that we have the authority either to enact or enforce. I have received contact from public safety folks saying, please don't do this. We're in the midst of some of the worst times we've been in the history of our nation. You're only going to create a more divisive issue for us, and we don't want to have to do it. I was in Newberry County over the weekend. They imposed an ordinance 2 weeks ago. I went into a business. I was required to wear a mask. I wanted to wear a mask. I should have worn a mask. On my way out, I said, how's this ordinance work for you? The quote was, it's been a disaster. I said, well, I don't live in Newberry County. Can you tell me why? Lady said, yes, sir, I can. She said, they come into the store, we stop our customers, we tell them they have to wear a mask. Most people are already wearing a mask, but those that aren't typically go to the car and get their mask. She said, but those that don't, I get called everything but Cora. Her name was Cora. And she said early on, we would contact law enforcement because people would either just push by her or just create such a scene. Law enforcement responding agents are saying this is a civil issue, it's not a criminal issue, and they don't intervene. Within our own ordinance, if we pass this ordinance tonight, and I'm just saying to you all what I've said to my fellow council members, if you have a religious objection, or if you say that you have a health care issue, the police can't even question you as to what that might be. So my position has simply been this is completely and totally unenforceable. My belief is that the people who don't want to do it won't do it, and I think they're stupid, by the way. I think they should do it. We'll use one of those two excuses not to do it. I have lost a friend to COVID. I've had a friend die from COVID. Chief cardiovascular nurse at McLeod's in Florence. Kathy Smith Sims had no surrounding health conditions that I'm aware of, was healthy, and she's dead. My dad's 95 years old. If he gets COVID, he'll probably die. I absolutely believe that everything our healthcare professionals have told us tonight is absolute truth. I have no reason to question. But I don't believe that, I think what we're actually going to do with this ordinance is to further divide our community. I'm told, and Julie, you would know if this is true or not, that a permit's already been requested for a protest downtown Saturday. Is that true?
That's fine.
That's true?
It's true.
Okay. So my logic is simply this. And my request for a proclamation, guys, was the strongest of language, not to suggest, not to recommend, but in fact to beg that our citizens do this. I truly don't think the ordinance will make much difference. I believe the people that see it as an infringement of personal rights will be offended by it and will not wear the mask in protest. But I believe if we ask and in fact beg rather than order, I think there's a chance that believing you're doing the right thing for your family, your friends, your neighbors, and your community, perhaps they would. Perhaps they would. I don't know, but perhaps they would. The people that have called and contacted me and supported this, we're going to do it anyway. I'm going to do it. But I want to say I'm going to vote against this ordinance. And the reason I'm going to vote against it is because I can't, in good faith, vote against the advice of the county attorney that we pay with your tax dollars to keep us on solid legal ground. Can't do that. So that's my position on it. It doesn't mean I'm not in support of our healthcare community. I absolutely am. And I hope if I wind up with COVID and in Jim's hospital, they'll take care of me. Thank you, Chairman.
Mr. Chairman,
Yes, ma'am.
before I make my motion, I'd just like to share with the audience that I've had family members who died from COVID disease. While one was being buried, another cousin ended up with COVID. And even closer than that, on last night, person that I've known all my life died. So I said all that to say that I personally feel that it's safer for us to wear a mask where we can protect ourselves from others and others from us. So I would like to make a motion that we accept the ordinance number 1 as our chairman has read to carry it out.
You have heard a motion from Ms. Childs that the council consider adopting ordinance number 1, which would be the one that mandated mask and would have a penalty of $25 for the individual and $100 for the business. Do I have a second?
Second, Mr. Chairman.
I have a second by Mr. Moats. Now it's time for further discussion. Any comments?
Mr. Chairman, can you hear me?
Yes, I can.
I can't hear y'all, that's why I'm asking. Did we just have a motion and a second?
Yes.
Yes, we did.
On ordinance, which ordinance, or what?
Ordinance number 1, which would require the mask and have a penalty attached to that ordinance.
I apologize to everybody in there, I just can't hear.
Any other questions? Any other comments by council members?
Thank you, Mr. Chairman. Let me say, first of all, thank you for our healthcare professionals for coming tonight and sharing your concerns for our community. And I hear you loud and clear, and I totally agree that from what's been said, we need to be wearing masks. I call my personal physician I have a 21-year-old son who is a senior at the University of South Carolina. He's been his healthcare and both of my boys' healthcare professional here in Greenwood for all of their lives. And as Mr. Brown said earlier, I called him on many occasions when they were small kids at midnight and they were running a fever of 102 and said, "What do I need to do?" And he said, "Put him in cold water, strip him down, get him in cold water, give him this medication, monitored every 30 minutes. And I didn't question that advice in any way. I took it because I was very sure that he was doing and giving me the best advice that I could get. And I called him and he said, yes, people need to be wearing masks. There's no doubt that it is critical that we wear a mask to protect ourselves and mainly to protect others. And he explained to me the situation at the hospital and that to have the number of respiratory illnesses this time of year is just unprecedented. It's just something you just don't see. So I hear you loud and clear. But my other issue is, again, and you've gone to medical school and you've got a world of knowledge beyond me in the medical field, and I respect that. But also, our attorney has gone to law school, and she has gotten her law degree. And as you were schooled in the medical field, she is also in the legal field. And when I get an email from her and she says, I remain very concerned about the legality and the enforcement of this effort, and I cannot recommend that you pass either. And I think it was a hard decision. I think she's giving us, as my doctor has given me great advice for years, this attorney has advised this counsel very well. I've been on counsel 9 years, and I have respected and seen more consistency in your legal advice than I have since I've been on counsel. I'll tell you that publicly, that you have advised us well. We have not found ourselves in situations. And when you question whether I have the legal right to impose something on someone else, I take that seriously. And then I have to weigh the health benefit to the liberties and rights of our citizens. And I've wrestled with this thing, and I'm going to be honest with you, I've changed my mind 4 times since I've been up here because I've wrestled with it. It weighs heavy on me because I've seen the passion that the CEO of the hospital has. I can tell he's concerned and he's got problems in these doctors. But then I see this gentleman here that comes here tonight, and he's just as passionate about whether or not his legal rights as a citizen of this country are being trampled on, and is he not being represented by us? So I wrestle with it, but I have to lean to my duty and my authorities that's given to me, and those authorities to put this ordinance in place and enforce this ordinance is in question to me. Whether I can legally and rightfully do that. So I have to not support it tonight and beg, as some have said, people, please wear masks. Just wear the mask to protect the general public.
Any other comments by council?
Mr. Chairman, may I?
Yes, Mr. Templeton?
Yes, sir. If I repeat anything that's already been said, I apologize because I cannot hear you guys. But we have a tremendous opportunity tonight to help fight this virus in our community. I trust everything that our medical community has said to us. Some of those folks are my friends. My best friend actually worked at the hospital. I've had a great conversation with Jim, and I believe his numbers are absolutely correct. But we have a tremendous opportunity if we work together on this, and I don't think an ordinance is the way to go. I know Jim disagrees with me on that, but our attorney's been strong on the fact that we can't, it's illegal and we cannot enforce it. But we have an opportunity to be leaders in our community by getting together with the hospital, with the city, with the chamber, with any other groups to strongly encourage, implore, beg, plead to people to wear a damn mask and wash your hands and socially distance. And I also hear very strongly the folks who are concerned about their rights. And for them, it's not about the mask. It's about another one of their liberties that they feel are taken away. I could be wrong on this, but I'm going to be willing to bet you that the majority of those people who are not wearing masks because they think they're getting ready to mandate it or because the city's just mandated, I believe that they will do what's best for their community, of their neighbors, and wear a mask just because we ask, not because we're told. Thank you, Mr. Chairman.
Mr. Modes?
Thank you, Mr. Chairman. For me, one of the core functions of government is to provide for the protection and safety and health of its community and its constituents. And we sat here tonight and listened to the medical community actually implore us, plead with us to do something because they are in a crisis mode, as Mr. Pfeiffer said. We must slow the spread of this virus. It is contagious and it is deadly. We mentioned how it is transmitted or not transmitted because of the wearing of masks. And for those who are concerned about their personal liberties, sometimes you have to give up a freedom for the good of everybody else. Sometimes you actually have to give your life for somebody else. I think of one man who did that for all of us. And wearing a mask to ensure safety and to curb the spread of this vicious disease is a small thing to ask when it can save so many, many lives. Wearing a mask will also, as we've said, reduces the infection rate. And I would say that without it, more people are going to be infected. And as the lady pediatrician said a moment ago, it's going to affect the economy because more and more people who work are going to be out. So businesses can't operate. So in a sense, we're protecting our economy by mandating that people wear a mask. And so, Mr. Chairman, I'm going to vote for the ordinance. It may not be legal. It may not pass muster in Columbia, but I frankly don't give a damn. I care about this community. And I want people to be healthy and safe, and I think it's the role of government to provide that kind of protection and safety. That is my comment.
Thank you. Any other comments? the talk has been that, about encouraging people, we can gain compliance. Well, I've listened to Dr. Fossey, isn't that his name, in DC? And if anybody has begged for people to wear masks, he has. I've listened to Dr. Bale at DHEC. She's begged us to wear masks. The governor has begged us to wear masks. And if those three people can get people to voluntarily wear masks, I don't think us up here are going to have any impact. And there are not many meetings that we go through up here that we do not deal with people's rights. We tell people what they can build on their property and what they cannot build on their property. We tell them what size house they can put on the track and what size house they cannot put on the track. We tell them so many different things. We require people to get permits if you want to dock on the lake. So when we talk about we're violating people's rights, we deal with people's rights all the time. And I do not tread on those rights very lightly. I take them very seriously. But I also feel like that when one person's rights infringes on another, then there's something that we should do. And we have voted on that time and time again. So I'm willing. I respect the attorney as much as anybody. But at the same time, there have been ordinances passed all over this state by counties and cities. And I feel like we are missing a golden opportunity to be leaders in this community. And the city took the initiative to pass theirs. I think we need to have one in the unincorporated areas. And I will vote in favor of this ordinance tonight. So with that being said, I'm going to call for the question. All in favor of this ordinance, to approve ordinance number 1, signify by the raising of your right hand. And that's 1, 2, 3. All opposed to this ordinance, signify by raising your hand. 1, 2, 3. Mr. Templeton?
Opposed, Mr. Chairman.
Opposed. So the ordinance fails. I will entertain another motion.
Chairman, I'd like to make the motion that we enact the resolution, even if it requires that we do it in the strongest possible terms, to ask, and in fact, as I said, beg that every citizen of Greenwood County do that which we've talked about tonight, not just masking, but every possible healthcare recommendation. I do believe I'm trying to lead, and I do believe that we have a chance to unify more than my belief that we were going to possibly create greater divisiveness. But I would make that motion that we enact the resolution as presented by the county attorney.
You got a motion on the floor. Is there a second?
Second, Mr. Chairman.
Second by Ms. Spencer. You have a motion and a second. Is there any further discussion or comments?
So what does the resolution say, Mr. Attorney?
The resolution essentially defines face covering and states that individuals are strongly encouraged to wear face coverings in all enclosed public spaces. When social distancing is not possible, individuals should follow CDC and SCDHEC guidelines for the proper wearing of face coverings, and should practice social distancing, hand washing, and other safety measures. County Council strongly encourages these measures in order to prevent the further spread of COVID-19 and to avoid the need for further council action regarding this matter.
Any other questions?
Mr. Chairman, I don't know if we can add it to the resolution, but I would strongly encourage that the county take the lead on this should it pass and get together with the city, the chamber, the hospital, and anybody else who's interested to bang the drum, spread the message, do everything we can, have a campaign if you want to call it a campaign, protect your neighbor, do it for Greenwood, whatever you want to call it. But we need to do this together, and together we're stronger. Thank you, Mr. Chairman.
Any other comments or questions? You ready to vote? All in favor of the motion, signify by the raising of the right hand.
Aye.
1, 2, 3, 4. 4 in favor, all opposed. And there's 3 opposed, so the motion passes by 4 to 3. It is a resolution encouraging people to wear masks. There is no other business for us to consider, so this meeting stands adjourned.